Welcome to Medical Mondays with Dr. O. I'm Dr. Tony Okpesomi, popularly known as Dr. O, and I host this program every Monday at 7 p.m.
with Dr. O.
We are always excited
Dr.
to
Tony
be here
Okpesomi, popularly known as
because
Dr. O,
we
and
learn
I host
a
this
lot
program every Monday
at
to
7
Medical
p.m.
Mondays with Dr.
when we do
O.
this.
We
We learn from experts. We learn different things that would help us in prevention and, keeping excellent health. We also learn intervention, but we all know that prevention is always the best thing to do. And it's why we have one of ours tonight, one of our very own family on Medical Mondays with Dr. O, Dr. Adeola Popoola, Dr. Adeola Olatunji Popoola, you know. He enjoys when I, add all his names. He's a doctor of physical therapy and is one of our elites in the United States in medicine, a life changer. I would defer to him to complete his introduction. And so, Dr. Popoola, you have the floor. I don't want to belabor things.
Thank you
We're
very
starting a
much.
little bit later. Welcome.
Thank you, Dr. O, and thank you for being so generous with that introduction. I never knew I could be so qualified as being an expert and something, but I value the whole aspect of support, and when I say support, supporting those of you who are in leadership who do give your best to make sure our situation gets better as humans and as Nigerians and as people that are on this forum. I've attended many of the presentations and I know that we have a very high standard and it's always been very, very useful. I hope I'll be able to at least come close, if not to the higher level, to the middle level, at least of all your presenters who are all quite standardized. Sincerely speaking, this topic came to me just because of what we are all experiencing in this current period of time. Particularly, I asked myself, why do people want to lose weight? I said, and the question came back to me, who wants to lose weight? Apparently, there are so many reasons. Some people want to lose weight primarily because they feel they will look better. Some people want to lose weight because they believe it's part of what they need to get into a particular situation. But the bottom line is that from the medical point of view, we're looking at who needs to lose weight. Because it's not everybody that wants to lose weight that actually needs to lose weight. We have people who, by virtue of their disposition, I've had pregnant women in the second trimester in particular, more concerned about their weight, okay, than about what is causing their weight in terms of how it looks, compared to what it should mean if the weight is increasing in proportion to the age of the pregnancy. And some are actually just flat out so concerned about the weight. And they are concerned about the weight immediately after pregnancy. Okay? There are people that are concerned the weight for, of course, reasons of, what do you call it? Social reasons. And they'll also be covered in this little presentation. But primarily, I have it here on the record I have with me here that people who wants to lose weight Come, I'm trying to get this straight away. I ran in from the road. Okay. Why weight matters for health? Weight is one of part of overall health. Some people benefit from weight reduction because extra body fat can place stress on their heart and joints, can also affect their metabolism and the function of other organs. So the goal is not perfection, it is improving health, comfort, and daily function. In which case, this presentation will be looking at weight management and weight loss from the perspective of what your medical doctor will likely want to advise you on when it comes to weight management. So, medical condition linked to excess weight, high blood pressure, which we all know, type 2 diabetes or pre-diabetes, high cholesterol, sleep apnea, fatty liver, joint pain or osteoarthritis, heart diseases, and risk factors for heart diseases. Even these conditions that I stated out, a small amount of weight loss will make significant improvements in the quality of life of the people involved. Most of the weight that gives people concern for other esoteric reasons like good looks and all that are the weight packed around the waist. And that also particularly have very significant health concerns or health implications. Okay, fat stored around the waist, which is called central obesity, increase the risk of insulin resistance, the risk of heart diseases, and metabolic syndrome. So, weight circumference is often used along with other measures of assessment to assess this risk. If we get to that point in a little time, I'll be able to mention how we do take the weight at the waist circumference and relate it to overall weight. In which case, ways of measuring your weight and make clinical judgment from it. All right. So, difficulty with daily activities. Weight loss may help when a person also experiences shortness of breath with mild to moderate activity. When you have trouble climbing stairs in your home, okay, or going to the next block to visit a friend and you're so breathless. Of course, a lot of people will have back pain, hip pain, or knee pain, which I mentioned earlier. Basically, all this you will normally say you have reduced stamina or you reduce mobility. There are also metabolic concerns at when your weight becomes too low or too high. Rather, let me start with too high. I'll go to too low after that. Weight is made up of several aspects. Your body weight is determined by your body composition for health reasons. The total body weight consists of muscle mass, which consists about 40% of total body weight. Okay, the muscles are the largest organ in the body, all put together. Okay, then your bone density, bone length also constitute a large percentage. Then the fluid in the fluid compartments of the body has the body weight. And the one that we are almost so concerned about, which is the fat, um, actually doesn't constitute as much, but has significant health reasons. So we also have all those in this mind. So in these cases, preparing for certain medical treatments also will make people want to lose weight. People want to have joint replacement surgery who are going through fertility treatment. And of course, people who are on management for sleep apnea. Some cancer treatment may also request, the doctor may require that you have to lose your weight. Now, when weight loss is not the priority, there are times when weight loss is not recommended or should be approached carefully. When a lady is pregnant or is breastfeeding, when somebody has eating disorders or history of disordered eating, severely ill and frail individuals, in the elderly population who are going through physiologic aging, and people who, for one reason or the other, can be regarded to be in a state of, let me use the phrase that is commonly used, um, um, unexplained weight loss. Let me put it that way. Okay, if you just start losing weight rapidly, then I'm concerned about, do we let you just continue to drop your weight when we know other things can be under it? So our clinicians decide what weight should be lost. Okay, a healthcare professional may consider taking your BMI, that is the measure we take when you take your height and your weight, and we divide it, and we have your BMI in about 5 or 6 categories, from low to very, very high, and we divide you from um, low or normal weight, overweight, and obesity, and all the other classifications. Okay, so I will now use the opportunity to now say that where we're going really is that people want to lose weight. People need to lose weight. Okay, now weight loss has been approached from several different angles. We have bariatric surgery, and we have so many different forms of that. The one that comes close to mind when you use the gastric band or stomach band, which means that the size of your stomach is reduced surgically by putting a kind of stricture on it that will reduce the space, the volume of your stomach, in which case there won't be room to put more food. However, interestingly, over the years, we've all been concerned about weight loss. And then this new group of medication came out, and their popularity is soaring every day. Okay, and they've been headlined by celebrities, TV personalities, and all the other things. In which case, we are looking at these new medications that have come into the market, and every doctor is would definitely want to prescribe it. I can tell you too, I'm taking this subject from the perspective that I also had every reason to speak with my doctor about this, and every reason to actually request that I was willing to be placed on these medications myself. And what are the reasons for that? This is where we're coming. Now, this group of medications are basically the one that is most commonly seen are the glucagon-like peptide, uh, one receptor agonist, GLP-1 RAs. And they are so common, everybody is using it, everybody is using it successfully. Sincerely speaking, I wouldn't know why anybody would say you would not want to contact a doctor to give you his or her opinion about whether it's going to be good for you. Primarily because you do not have to do too much, okay, and you definitely will lose weight. Most people, anyways, at least 70% of people will lose weight significantly within the first 4 to 12 weeks. Okay, so I have them in categories, and I'm going to briefly go through those categories. Can I take a look at the first slide? If I have the privilege to take a look too, can I pinch it on it here to see where I am? Pinch larger. Okay, all right. Okay, okay. The first set of slides are not on that. Okay, so we have this. products, and I'm going to mention some names as we go down the line. We have these products, and primarily what they do is that they reduce the appetite, they increase insulin secretion, they slow gastric emptying, and they promote weight loss. Most of them primarily that's debuted this age of these medications were aimed at supporting the treatment for people with type 2 diabetics. And down the road, they found out that even it has significant effect for weight management. But the truth of it is that apart from weight management, these medications also have so many general effects, okay? Because obesity or excessive fat in the body primarily disturbs a lot of homeostasis or metabolism. Okay, there's a lot of chemistry in that area. If we get to talking about that, I might be able to share some thoughts about some of them. But basically, um, I have the categories in my hand here will include the semaglutides, the tirzepatides, the liver glutides, and the examples of this, which I have with me, I actually have my own sample of Ozempic with me, which is a good example of a semaglutide. Okay, I hope you can see that. And we have Wegovy, which is also a good example of a semaglutide. And we have Manjuro, which I thought would have been the better choice for most people. And we have Ribellos, which is the oral type. The other ones are
You are
subcutaneous.
you are not you are not centered
Oh,
in the camera.
okay. I was trying to get
Okay, that's
because
better.
what that's better. That's going to screen my laptop.
Oh, sorry.
I was trying to bend these things. Let me see. I'm going to do it better in a minute.
Okay.
Yeah, actually, I jumped into presentation without preparing my table.
Yeah.
Yeah, and I'm trying to find where XYZ is.
Sorry, I know you've had a long day.
Yeah, yeah. Actually, I jumped in from the road. I thought I should. You said don't drive and be talking. So I
Yes.
pulled into a public library, and when you were talking to me, I was still asking them if I can use one of their rooms. They were all booked. They put me in
Okay.
the corner. Yeah, very nice people, I should say.
Nice.
Yeah. So we have this group of medications. I have the Ozempic, yeah, like I said, which I was trying to show that the subcutaneous one, and it's supposed to be a pen. Everybody in the world knows how to use it easily, but the only two occasions I used it, I had to go back to my doctor to apply it for me, and that's simply because I wanted to make him talk a little bit more about it. While I'm using it. I usually want to know why I'm using these things. Okay. Number one, um, these medications, they are excellent as far as I can say. However, I came from the background as a physical therapist. Okay. I'm trying to complete the introduction you are trying to make of me. And that background um, says that mobility, movement, which is a very, very basic attribute of living things, is the basic thing that keeps the life going. Without movement, we learned in what do you call it? It was a general science in early elementary or early high school that um, characteristics of living things. And the most important characteristic will be movement, mobility, one way or the other. So we have all this that whatever happens in the body, there is only one organ, that's the muscular tissue, that creates changes and differences. Every other organ functions with the muscles around it, muscles supporting it, or muscles moving it. So they come so vital as the basis of why metabolism gets controlled. Okay, and it's not just movement. Muscles are not just for movement in space. Muscles also function as a form of creating energy, and I said also taking care that all aspects of the body uh, could function. Without the efficiency of your muscles, your cardiovascular system, your circulatory system is likely to be inadequate in functioning. Okay, will not even function. Okay, and of course, your GIT is not going to function. Every aspect of your body, your muscles are the thing that causes the difference. Even when I'm seeing people with joint pain and not the other thing, and I insist that we have to do these exercises and not the other thing, is that because I know that whatever surgery or whatever the chiropractor has done, whatever surgeon has done, without getting the muscles to move the joint, to stabilize the joint, okay, and to support the joint, then you are not going to have any improvement or recovery. So that's a little way of looking at it. So these medications primarily, like we said, are aimed towards um, diabetic control. And the second, diabetes is something that ravages the entire body, and every piece of tissue can get involved in it, particularly because insulin, which is a very, very important enzyme of the body, okay, and glucagon, these are the two things that causes the tissue inflammation across so many other tissue areas. The muscular tissue, particularly, impacts the function of this. The activity of these hormones and the enzyme that they support. So these are basic things that when we start discussing, by that time I will have been able to put this one in consideration. Okay. However, as good as they are, I have it here that as good as they have limitations. That is the most common one, which is the one that I have in my hand, the semaglutide, the Ozempic, and the Wegovy or Monjuro 2 are all the same limitation. I experienced the limitation. Okay. By the third day, I knew that I was having heartburn. Initially, I did not even remember why. I said, where did this come from? I knew I was having a sense of fullness that was making me belching and gouging. So in such an extent that I felt now this medication is having an effect. Did I lose appetite? Honestly, I lost my appetite significantly. Okay. I knew I was supposed to eat 2 or 3 times a day, but to even eat more than one time was like I don't need the food. So they do work. I can very much say that they do work. However, I also realized that I became more drowsy. I also realized that I actually was feeling too light. I felt something was wrong. Initially, I had to take my blood pressure. My blood pressure soared. But that is not a reason that we are talking about. It's supposed to actually even lower your blood pressure. Mine went up. So I looked at it from that position and I said, what was missing? And I had a gym pass. So I decided to do what I knew from a very, very long time. Say, okay, start going to the gym and let's see whether it will modulate all these changes so that you can have the benefit of this new medication you've started using. So I have it on the screen there. If you can show it, limitations of GLP-1 receptor agonists without exercise therapy. Impact on weight management, treatment, duration, side effects, and long-term outcomes. Um, we mentioned reduction of appetite. Okay. Okay. When the appetite is reduced, that doesn't mean that your body do not need energy. Okay? Now, you're not eating and you are losing not just calories, you're also losing the vitamins and all the other things. Yet you do not feel like you want to eat because the appetite center has been basically suppressed. So exercise is required to maintain metabolic rate, joint stability, and functional capacity. If I take it one after the other from what I have on my preparation slides, exercise is necessary to maintain metabolic rate of your body. A colleague of mine, I'm sure is on this Zoom, basically was describing to me at a point that while exercise provides a uh, push through benefit for the body to jumpstart its metabolism. Okay, and that's because of the activity of the muscles, like we are trying to say. If the muscles do not pump, if the muscles do not support the heart in pumping, let me put it that way. When the heart pumps out the blood, the heart itself is a muscle actually. When it pumps out the blood, it takes the artery, the muscular walls of the arteries to continue to guide the blood all the way down to the distal extremities and to the arterioles and to the capillary levels. And it takes the slight muscle of the veins to also help to push it up. So without the muscular activity acting like a secondary pump for the body, the return of blood may not be as efficient. And of course, that will cause heart failure, basically. So exercise is required to maintain metabolic rate and also functional capacity. Leave joint stability for a while. I'm going to go back to that. Without exercise, weight loss is less durable and side effects are more pronounced. In which case, even though you may lose weight, I'm going to talk about that too. I must talk about that. You may actually lose weight. Then what weight are you losing? Are you losing what you need for functioning, or are you losing what you want to get rid of, but which is linked to other things? Then we're going to talk about fat in a few minutes. Okay, GLP ones, that is the GLP-1 receptor agonists that we're talking about leads to muscle loss without resistance training. I'm going to discuss that immediately. Let me say it because we jump. I don't want to jump on things. Number one, when you lose your body composition, like we said, is muscle mass, is bone bone density, is water compartments or fluid compartments in the body, and let's say fat tissue. We're dealing about the fat now. Okay, so when you take this medication on a long-term basis, because you are required to take on a long-term basis, you are likely to lose weight, but what have you lost? Okay, um, a couple of studies that I have seen a couple of studies, and basically they say most people you will lose about 10% to 24%, or let's say 25% of lean body mass. Okay, when they are trying to lose weight. And that goes with so many other ways of weight loss. So without exercise, you are losing what exactly will have made your life a lot more functional and a lot more efficient. So you become frail, you become weak, and of course, in many other people, I don't know why I put women with joint pain or deformities. Men also have joint pain or deformities. We become frail, and you become more fragile, and your tissues are less supported. Though you've lost weight, but now you've lost who you are. You've lost your capacity, your ability, and your quality of life goes down. We see that typically when we have patients who are long term in the hospital, or patients who have fractured and the leg is immobilized. By the time you take the cast out, you will have seen so much changes. The first thing is that the leg becomes so much smaller, that is, it will have atrophied, the skin changes will be there, and of course, the circulation will be very, very poor. In which sometimes you actually start thinking that if you just have a sprain or a sprain and they put you in a cast, you wonder if you should have just kept your leg in a bandage and not lose every other thing that you've been losing. So that factor is there. So muscle loss, long-term weight loss, leads to muscle loss in many of these in many of these medication. Now, because you lost your appetite, because you've lost your muscles, because you've lost the drive to do so many things, the tendency is that as soon as you go off the medication, your body cries to refill itself and get itself back, and rapidly you gain far more weight quicker. And this is not just because of the this semiglutides, it's every way of weight loss. Most people will come back after the period of weight loss and they will have regained the weight more rapidly, with the body now even blowing up a little bit more. When we get to discussion, we may discuss why that happens, why the body now decides to protect itself a little bit more. Weight regain is faster and more pronounced after weight loss and pharmacotherapy. Okay. GLP is also, this is where we are coming to. The insulin sensitivity goes this way. Muscular activity actually serves as a kind of buffer for the insulin, okay, to be produced by the pancreas, and to also improve this the secretion, the sensitivity, and the secretion of insulin. Okay. Now, insulin now on the other side improve the microcirculation into muscular tissue. Okay. And also this affects the production of ATP, ADP, and all those things of the Krebs cycle. I don't know where to start that from, but let's just know it that way. When we can get there, we'll get there. So in which case the muscles get more efficient and circulation improves. Okay, and there is what I call that's almost a synergistic effect. Okay, that effect too is felt in the liver. Okay, in the heart tissue. Okay, and so many other areas of the body. And this underscores why you see that usually with this medication, what the literature says is that it helps to lower cholesterol, the LDL, the triglycerides. Okay, it helps in reducing fatty liver, actually controlling it. It helps in reducing heart failure and the risk of heart attack and stroke by influencing peripheral heart resistance, in which case PAD, peripheral arterial diseases, also helped. Of course, we just mentioned sleep apnea, like we said at the earlier part of it. So, apart from type 2 diabetes and weight management, potentially this medication have all those good effects. However, these good effects will not be realized until you start doing some exercise. So, what I've been trying to do since I use myself as my guinea pig for this medication is that I prepared a kind of 6 weeks program for my patients who have, and I have 4 patients who are on it. Dramatically, they lost weight. Okay. But when they started the exercise program, so the first 1 week or 2 weeks rather, they were only coming in and we'll talk about it, we'll walk around and all the other thing. And they independently, they will use the bicycle, they will use the little machines that I have in the office to work on their torso and their posture. Okay. Now, the big thing there that happens is that thereafter, they said their appetite, even though they don't have that strong appetite, but they are eating better. So after a while, I also realized that because they were eating better, they were actually moving a lot better. So we increased. I said, okay, let's formalize the program we are doing now. Then started doing the intermittent walking, brisk walking, which they were not able to do when they were significantly very overweight. These were people in morbid obesity. At least one of them was, and she was already reduced to wheelchair functioning. So at the end of the day, we were able to let these people, the two of them that started with me, who have spent at least about 12 weeks now, okay, already are able to walk almost half a mile without collapsing. Okay, that means you walk the rest, we walk, we walk, the rest up and down in the hallway. But the bottom line, what I'm trying to say is that these are the effects of why this exercise has to be put into the regimen of anybody going through weight reduction with pharmacotherapy or with surgery at the same time, where we're dealing with pharmacotherapy as that now. So what did we do? Two types of exercises. This is why I was invited to come and talk today. Actually, I was invited because I was supposed to demonstrate some exercises that are involved uh, in this process. So, if you want to go to the third slide, and I say it actually lowers total daily energy expenditure. Patient may override appetite suppression with calorie dense food, which is what everybody does. Even though you will have a control way of eating, but when you unleash on eating, you just overeat again. And the consequences are you reload your weight and all the other illnesses may start coming into play. Okay. Chronic pain may worsen due to instability and deconditioning. We just said that when the muscles don't have their strength, their dexterity, and when there are signs of fibrosis, when there are signs of inadequacy of contractility, circulation is impaired, both central and peripheral mechanisms is impaired. And of course, the cardiac and lung function is also reduced. So now, but with this group of patients, what we did was that as soon as we began the treatment, it was now important for me to take a look at what other thing we have to put into the treatment to make it in such a way that we want to continue. So we started taking the blood pressure and the heart rate. Okay, this time we are not touching any of the medication. We are not touching the medication for blood pressure, for hypercholesterolemia and all that. We are not touching the pressure for every other condition, even including cancers that one of them had. But we just took the blood pressure and all the other things. Then that made me come to the second aspect. There are some blood pressure medication that seem to be so synergistic that it work alongside with this medication, with the semaglutides. And that's from personal experience now. And that's from the experience of what I saw in other patients who use it. And I've advised them that, well, instead of taking this, why don't you tell your doctor that you want to try this medication and see whether it will give you better effect? So I have a list of those ones. I'll mention them as time permits me. Okay, longer required duration of pharmacotherapy. So to gain the same effect of weight loss, okay, with pharmacotherapy alone, you have to stay on the medication longer. The impact of that is basically what I will call the longer you stay on the medication, the more the tendency that you become addicted to the medication. The more the medication continues to have less effect on you. Okay? But meanwhile, your skeletal muscle will be wasted and your body composition is altering in a negative direction. Okay? That is, the adverse outcomes becomes to increase while the beneficial outcomes becomes to reduce. Okay, and this is where we are going to when we get into a discussion stage. I'm going to spirit us to that area so I can take your questions and contributions. It will bring my brain back. Okay, so the major insulin dependent tissue, that is the muscle, increase in insulin sensitivity. And because I do tell people, even from time immemorial, that the same blood sugar that causes diabetes, okay, put everything aside, is what you use, okay, during exercise. In which case, if you burn the blood sugar regularly, then you're likely to have blood, less glucose in your blood, and you're likely to get, you're going to improve the insulin sensitivity apart from secretion. Improve sensitivity of your muscles, and your functioning will get better. So that is one area. So 7% of glucose uptake, okay, occurs because of muscular activity. So if you do not do all the exercises, basically you are shortchanging that aspect of it. You are going to have more glucose available in your body and in your blood, and that may lead to pre-diabetes and down the road to diabetes. So let me quickly go over to the body composition. More muscle is lost, there's slower metabolism, weight maintenance, higher regain after stopping the medication, and less durable improvement. That is, you cannot sustain the improvement after a while. Side effects. The side effect of the medication, we did mention that, which includes gastrointestinal symptoms, signs and symptoms, a feeling of bloating, and of course, a little bit of tiredness. Uh, I believe I was supposed to, from literature, that I was supposed to feel constipation, but what I had first was diarrhea. Then later, constipation came over. So these are some of the things that start with just 15 to 30 minutes of aerobic and strength training that I did with myself in the gym for just 2 weeks. Okay. So exercise therapy is essential for safe, durable weight management. It protects the joints and function and reduce pain and deformities. It enhances metabolic outcomes in patients with metabolic syndrome, reduces long-term dependency or reliance on GLP-1 um, um, medications, GLP-1 agonist medications. So this is how I'm going to stop the presentation and start asking for questions and contributions, and I'll be able to take it from there. Thank you.
Thank you so much, Dr. Popola. I'm now going to lie. I was looking for exercise, ways to lose weight, and seems like you focused on the weight loss medications that have now taken over the market. But I got something from your presentation that taking these medications have side effects. And not only that, they don't sustain the weight loss, even if people lose weight on them without adding exercise. So exercise is important. Correct?
Yeah, you got it correctly. It's actually not just that it's important. Actually, I have it in my brain, and I said that exercise brings the medication to living. That is, your quality of life becomes better. The medication itself doesn't make you feel better. Okay, but if you take medication or you go, let's say with the pharmacotherapy. Okay, the medication itself doesn't make you feel better. Okay, the exercise components is what will make you actually better, and that's why I call it as a core therapy. Okay, we make weight management. That is, you just cannot do it without it. Weight management without exercise therapy that is structured in an individual way will not give you the benefit you deserve or you want.
Got it. So I'm glad you actually presented it, truthfully, because a lot of people now look to getting these medications, and the insurances usually don't cover them unless they have diabetes, because first the medications to treat diabetes, or they then try to get it online. But we see that a lot of online pharmacies have been shut down because some people actually, I think, I can't remember the number, 3 or 4 people died from medications they get online, these online pharmacies, and some had some health issues. So, like hundreds of them have been shut down, which is a good thing because you want to get your medications from clinicians who are trained to prescribe them and who would look at every other health issues to know what would be, to know if the medication is right for you or not. So I'm glad you presented this so that people can see that, those lifestyle changes with exercise. You talked a lot about exercise. What about diet? I mean, eating, I don't mean going on some prescribed, online diet or something. I'm talking about just making right choices, eating right with exercises. Do they have better impact on weight?
Um, if that's a question for me,
Yeah.
number one, I will say yes. However, it still falls because we are talking about the caloric energy balance. Okay, the bottom line is that if we want to go into it the way it should fit into this presentation, I'll possibly be talking about the ketogenic diet. Okay.
Ah, ketogenic diet. That
Yes.
it increases cholesterol, LDL cholesterol, that is
So
what
don't worry.
cholesterol
I
to
know.
the
I like you. I like the
hundreds.
way you join into it. I
No,
like.
to the hundreds, it does. So that's what I was saying, that, medicine, I know that we don't recommend this, fad diets, but I mean, just eating right, making right choices. Would you recommend that in eating, like decreasing fatty foods, fried foods, making better choices? Would you recommend that?
Yeah. I will recommend good eating. I will recommend eating more fibers, eating more fruits. Eating. The bottom line. The bottom line is that when this food goes into you and you are in a state of morbid obesity or you are extremely overweight and you are seeking to reduce weight, diet itself uh, will act just to reduce the, let me say, more about the inflammatory activities that leads to that obesity contributes to and leads to obesity. So definitely diet is important, is a constant factor. But we're looking at an intervention that at least that you can proactively do. Diet basically on its own will go along with all forms of management and treatment. But diet alone or diet with exercise will
Mhm.
be the choice to go in
In
any
it,
way
yeah.
because we need to provide the energy, but the movement itself. Why I mentioned that kind of food is that, oh yeah, I can see somebody clapping for me. I love that. Thank you.
Okay, so
Why I
let me.
mentioned
Oh,
that was
sorry.
that number one, in weight loss, okay, what you're having is that the person who is overweight is also the person who is likely to be at a buffet, okay, and pack his plate full 3, 4 times, okay, and will still take away. All right. and you start wondering, where else do you want to put this food? I thought you're overstocked by your body. So what happens is that there's always a balance between those two hormones, insulin and glucagon. Okay, when you convert from having to use glucose, okay, and glucagon as a source of energy, okay, then this is how this medication also work. They promote you using alternative form of fuel in your body. Okay, and that's where that kind of diet comes in. That is, I do appreciate that you have to, but you may be able to still get away, eat your portions rightly, correctly, a balanced diet, okay, and the body will still prefer to burn your fat out of your body. What we've always had is that it's so difficult, it was so difficult without this medication to get rid of abdominal fat. Okay, and people will tell you that they you exercise. I've exercised several times. To get rid of it, it's not as easy as that. So something has to creep in, and this is where this medication come in. They actually creep in and preferentially burn out the fatty tissues. Okay, and it can also be used with physical activity to produce energy, in which case, that is why the ketogenic claim comes in. It works synergistically with this kind of management.
Thank you. Dr. Buka, and then I'll call Dr. Dija. Dr. Buka.
Yes, this is interesting because for everybody, I've been on Monjaro for 2 years. And I was put on it by maybe more than 2 years, my diabetic doctor when it first came out. And his thing, he didn't insist so much on the weight loss, but he did say I would lose appetite. And he claimed that I know it was developed in Denmark, when there was something in the eel, the saliva of the eel. And when you eat, that's when this insulin is secreted. It's not done normally. So my insulin requirements dropped quite a bit. I was on maybe 25, now I'm down to 12. But I've lost weight. And I could tell you, I was one of the initial people on it. There is the loss of appetite, but there's a CNS effect, just like he described. You see food and you don't feel like eating it. And then there's this decreased transit time. I eat at 6 o'clock and I think I'm fine at 8. And by 9 o'clock, my monitor is saying your glucose is high. The transit time is so slow. So, but then after a while, when I got to the gym, I was always exercising and I was losing weight. Oh, I have to sew in my clothes. But one day I got to the gym and they say you should feel this in your glutes. And I felt nothing. And I came home and said, to hell with this thing. Because my signature was my butt. And I'm not joking. When I went to medical school, my waist was 23, my hips were 38. So even when I got to Nigeria, most of my school mothers said, where is the Nyash? This is what we knew you as. I did I did increase, I put it down. So
She went to University of Lagos.
Is it Lagos or Port Harcourt? I thought she went to Port Harcourt.
Lagos.
That one didn't exist then. Joe?
Okay, it wasn't there then. It was. I give that to
She
you.
said it didn't exist then,
Yeah,
Joe.
I know. That's why I gave her the term. It didn't exist then. It did
It is
not
true.
exist then. Yeah. Yep.
Yeah. So anyway, I looked at the thing and I went back. My blood pressure went down. My doctor was happy, everything. When I went to do my mammogram, the technician looked at me and said, my goodness, is that you? You lost 30 pounds. That's when I was weighing. Okay, fine. But I can tell you, I go to eat and I would look at food and we go to eat. Do I need chicken? Do I need beef? It was terrible. That CNS effect was terrible, worse than the transit time. Anyway, the next year I end up with thyroid nodules, which people are not. I had to go and get them biopsied, and I have to go back for a scan. Last year when I went, the same technician came back and said, "Oh, I'm sure everything is fine. I said, how do you know? She said, because last year I was the one who did it. I said, yeah, you ran out in one speed. I did see how you ran out. And she said, oh, I'm so happy you're doing better. I still have to go back soon for another scan. But today, it came out today on the TV that people are having problems with bone density, with Wegovy, with Ozempic, bone density and muscle mass. Now I exercise, so, but I still, you know what I do now? I eat. My whole thing is to gain weight. When I get up to 140, I'm happy. When I go down to 135, but don't listen to me. I take it once a month. So I am not your typical patient. I'm a physician. I know once I see my insulin goes up a little bit, I take it. When I was going to Nigeria, I did not take it.
So
And I ate amala, which I never
you
ate,
did that
and
you
it
did
was
that
good.
Lagos Owambe.
I did not take it. So don't do it like people take it every week. I swear I take it once a month. But if I say to people, if you can only eat a spoonful of rice when you're on it, just keep on doing that when you're off. Your appetite may go up a little bit. Like today, I know I ate 3 times for the day. So I'm saying, oh, I'm going up. I had bread in the afternoon. But I ate a lot of fish. So just look at what makes you full and go and do, when you were talking, I was riding my little bicycle, my little thing. Oh, that's my glucose is up. I was,
Exercise.
yeah, I was riding my little thing while you were talking. So exercise is very important. I do it about 3, 4 times a week. Um, and I just stick to the small portions. And so I've lost weight and it works for me, but I am not the type who is going to be on it all the time. I can regulate my food, then I change to beans and, different things. But anybody could ask me anything. I am been on it for about 3 years. Mm-mm.
For about
No,
three
I don't think.
years.
Yeah, when
Since
Monjaro first came out, I was placed on it. Mhm.
Yeah, uh, what you said is actually what I can tell you that I observed. I observed it on two of my patients first before I went to submit myself to my physician that this thing seems to be working because I couldn't get these particular individuals, okay, to even use the bicycle ergometer, the exercise bicycle, even the one you sit on, the one you ride with the hand. Okay, and I couldn't, like Dr. Okpesami, Dr. O mentioned, sorry to use your full name, sounds better with you. Dr. O mentioned, okay, they have, because they belong to what they call adult daycare, and they were on a special nutrition and all the other thing. But yet, they were always
Mhm.
munching continuously, one way or the other. So and I said, how come you're losing weight? He said, oh, did you notice everybody is saying that, just like you said? And she had reduced her intake as well. But that is actually because the gastric emptying is slowed down. Okay, so we want to separate. I'm trying not to commit myself to a lot of the physiology or the biochemistry of it. Okay, I mean it's like the food is not digested. It's not living. Okay, and your intestine is maximally, okay, drained out from whatever gets into it, and your liver and your including the liver cells, the gallbladder, everything it potentiates, and they are doing a better job because there is better sensitivity to the insulin that is being produced by the body. So it affects so many organs and systems that definitely, but the tendency is that this medication will be subject to abuse, just like you have avoided. Okay, it will be difficult to tell people that stop using it every week. I don't know the people who do it every week for 6 weeks who would not have felt they have overdone it. Okay, that is the way I want to look at it. But all my patients that I'm talking about, the longest one that joined latest was at about 8 weeks of continuous use. Okay, the others one were much more in the earlier time. But sincerely speaking, with the exercise, the affect that is the mood, everything looks better, everything feels better. You could not imagine these were people who are already restricted to wheelchair functioning. Okay, and even I don't want to commit myself to it. I'm not too sure whether there's enough physical therapists on the forum. Dr. Karim, are you there? I've been trying to hit the participants to see, but it's not coming up.
Yeah, Dr. Dija has her hand raised. So
Okay.
kindly unmute. You have the floor, Dr.
Thank
Dija.
you. Thank you. Good evening, Dr. Owen. Good evening, Dr. Ola. Thank you for your presentation. I
Thank
just
you.
wanted to add, piggybacking onto your last explanation and Dr. I can't remember her name just now. The
Dr.
last
Booker?
Dr. Booker?
Booker. Thank you, Dr. Booker. Yeah. So for me, for example, I may not be a typical patient because I wasn't really diabetic, but I started having damage because I went into the doctors and there was no knee jerk, right? So neuropathy was setting in, even though I recall at some point I was only borderline. And even at the time that this knee jerk wasn't there, I wasn't near borderline, you know. So I'll be one of those that kind of made those Zempics, the semaglutides, scars in the pharmacy at some point. I'm a pharmacist. And even the diabetic patients couldn't get their medication simply because we had aesthetic use of the medication, you know. And we know that obesity, right? It's a very key factor, a risk factor to other chronic diseases. And sometimes we look at it as a behavioral versus it's a disease status by itself. Now, for me, just like Dr. Booker, I only was on it for 6 months and I wasn't the weekly type. I was every other week, sometimes once in 3 weeks, and I was able to manage myself. But we can't say that for regular patients that have no idea. The doctor put me on this and says I have to do it weekly. They're brainwashed into doing it. And of course, there's a whole bunch of side effects that comes with this. All the nausea and vomiting and constipation because there's no gastric emptying. So it's like a two-edged sword, if you ask me, even though what I took away from it is if you had a reason in the first place to go shed this weight, most of these medications are not covered by insurance. You're self-covering it. It's not cheap. Maybe a box of Wegovy, for example, was like $630 by discount. By discount. If there's no discount, it's 1,000, 1,300, kind of. So you finish this, I lost 71 pounds. I don't know if I mentioned already.
You
And
lost
then
Wonderful.
71
I
pounds?
lost 71 pounds.
I don't
I
see it.
was,
I cannot picture 71 pounds.
you didn't meet me when I was big. I was
Wow.
246 pounds.
Wow.
I wasn't that when you saw me first time, when you came from my event. So yeah. So I was 246 pounds. And at the time I stopped, I was 175. I wanted to be 170, and my daughter was mad because she was 160. Like, why am I going to be close to her size? So I stopped. But one thing I took away, like I was saying, during that time, like Dr. Tabuka was saying, if you're able to eat a scoop, a spoon of rice while you're on it, mentally, for that amount of time, you should be set now to say, oh, I should be eating just this amount of food. And up till now, I take my coffee in the morning and I eat once a day. That's how I maintain. Was it easy? Easy? No, because I'm back to status quo, my appetite, food craving, and things like that. Now, I wanted to add because I got introduced to a product, right? And I use that on my mom because she's diabetic. We went for our appointment, 3-month appointment follow-up. She was, I think, in the six, her A1C, and was it on Thursday? Her A1C was 5.4. I was like, okay, that sounds even better than for me, you know. And I'm encouraged to keep her on what I'm doing, just so I can help her, get away from drugs. Because we all know drugs is just cyclic, even though I sell drugs. I'm a drug ped. I'm a
Dr.
I'm a legal drug. I'm a legal drug peddler. So yeah, thank you for this awesome
Well, thank
presentation, Dr.
you. But
Well,
Thank
I
you.
beg to
let me quickly
disagree.
say that the two contributors, sincerely speaking, are not my typical patients, like they said, because they already have been putting this exercise as part of their lifestyle. The majority of the people that come down with problems are those people who are not actually I don't want to use the discipline, not informed enough about their need to be physically active with or without their weight. And
For me, unfortunately, or however, I happen to suffer from pain. So I could not exercise. I couldn't, not 1 ounce of. I just had a rotator cuff surgery, all from the pain I've been suffering for years. So I could not add exercise to it. So when I saw your topic, I'm like, gosh, I gotta be
no,
here
no,
just
no, no.
to
I can
at
come
least
to
let
the.
me
I
see.
want to put the joints on aside because, sincerely speaking, it's interesting when you see the potential benefit of this medication, but you see that it's subject to abuse and it's not well
Yeah.
understood, even by our physicians who are prescribing it. Okay, and of course, already we have the disparity in health and social services, and the people who are caught in this overweight syndrome, metabolic syndrome, or they are the minorities and other things who also cannot afford the medication.
Mhm.
Okay, and this is actually some of the reasons. Everybody in my group are in that group
Hmm.
of people who either will not be able to afford it.
Well,
Uh,
so lifestyle changes is still what we will preach. Eating right, and
but I'm
it's
trying to
one
tell
that
you
we
that
will
a
do.
structured exercise program to go
No,
along,
with exercise,
no,
absolutely, with exercise.
titrating the exercise into the medication for long-term effect. That's what I came to preach, and I hope we can get there. Your
Uh,
own.
I don't know. I want to ask Dr. Alu's question, and
Thanks.
then we will come back to this. It says, is walking several kilometers and intermittent fasting good enough therapies to ensure weight management? I'm wondering what you say to that because we have research proving results on his question. So what do you think?
Already, sir, you are doing something very beautiful. However, monitoring your exercise is an important thing. Exercise under some conditions can be just generalized, okay? And can also, like can use exercise just like you use your multivitamins, okay? In which case you underuse or overuse it, you actually don't monitor how it affects you. But when you are in the categories of people that it's now become that inadequacy of mobility or movement or exercise as an ingredient to upgrading the status of the body and reducing the effect of diseases, then the exercise has to be in a prescribed model. Yeah.
Floor's closing in less than 5, so I need to start clearing the rooms out, okay?
Oh, okay.
Floor
Okay.
closes at 8:25, so.
Oh, we spent so much time already? Okay, I get you. All right. Okay. Yeah. This is not my home. That's
And
interesting.
and thank you so much because we know that you were traveling from New York to New Jersey, or I knew that. And I
Yeah.
thank you for, even stopping by the library to still make sure that you do this talking. But I'll take over so that,
No,
you
I'm
have
still with you. I'll leave the room and sit in my car.
okay.
Yeah.
So I think you can continue your comment then. I don't want you
Yeah.
to violate their
Yeah. They walked past one or two times before they came to knock the door. That is
okay.
8:25 already. They close at
Yeah.
8. That's it.
They close at 8:30.
Yeah.
Okay, so I think you should start getting ready to go so that you have 8 minutes.
Yeah. So what I'm saying that so typically we actually will want the physician who are likely to prescribe this medication, okay, to know that it's not just the end of the statement. Otherwise, you'll be causing a little bit more problem down the road. Even the long-term effect is still unknown because it's still relatively new. Apart from Dr. Booker, I'm not too sure I've seen anybody who have used it for over 3 years or about 3 years. I thought everybody was in a
Remember,
sense.
Dr. Buka uses it once a month. She's not using it weekly.
Well,
Like,
sorry.
go
I
ahead.
when one comment when we started, I was on 2.5, and that was fine. The insurance says that you cannot stay on 2.5, it's only a starter. So you had to go to 5. I could do 2.5 every week or every other week. But when it came to 5, and my appetite was gone, and all my expensive clothes, I have to go and have them sewn in. That is it. I could modify my thing. But one thing I wanted to say, your patients, oh God, my glucose is high. Your patients have to, if they're going for surgery, they must tell the anesthesiologist because the transit time is so small that they are treated as full stomachs. So they must let the anesthesiologist know, and they cannot use those 2 hours pre-op. They may be given like 8 hours like it used to be. But they must not hide it from the anesthesiologist because you're treated as a full stomach because your transit time is so slow. That's
Yeah.
the comment I wanted to give.
And Dr. Buka is a retired anesthesiologist, so she knows the stuff. She knows what she's saying. So the medication, Dr. Kokola, what you're saying is that you don't get on, even if you're prescribed the medication for diabetes, for weight loss by a physician, you're saying that you need to do exercise along with it.
Yeah,
And
prescribe
we don't,
exercises.
yes, we don't know prescribed exercises, you
Yep.
said,
Yep.
but you've not been able to go into what prescribed exercises is.
Yeah, yeah, we'll take that in the discussion because each case is different. Like if we're talking about the laxity of joints, okay, and the rupture of joint tissues is different from when you're talking about the aerobic conditioning, that is also part of the syndrome. Uh, Sedentariness and metabolic syndrome. Yeah, I've left their room now just to get to their door to make sure I'm not locked in
Okay.
here.
So,
Okay, so the actual prescription is necessary so that we can titrate. That is, the first 1 or 2 weeks. I think anybody can just be on it as much as possible. Whether, yeah, have a good night, man. Thank you so much. You are very kind anyway. I love you. Yeah, some people you could have been more rude. Okay, so that this is titrating it. Let one walk the other through. Then we have the benefit of it for a long time, and you can then wean the patient off the medication, even if that will be intermittent use. What Dr. Booker has been doing and Dr. Sorry, I lost the name. They made me pant again. I've been doing is that you self put yourself off the medication, in which case you didn't give your physician who prescribed it the privilege of understanding the effect of the medication on you. Am I right, ma?
you're right.
Yeah, because that's
That's what
one
we're doing. That's what Dr. Booker said, and that's what Dr. D just said.
Yeah,
You know.
yeah. Sometimes we want to understand what the real effect is, and now we can take. Thank you so much, please. Yeah, yeah.
So I want to go to the intermittent fasting. Intermittent fasting, in case somebody on the platform does not know what it is, picking a time that you're going to stop eating um, in a day. So you can pick maybe 6 o'clock, 7 o'clock at night that you stop eating. So if anybody brings you something after that, if you see food after the cutoff time that you have picked for yourself, you don't eat anymore. You can drink water, but not food. And then you fast for at least 15 hours. Mind you, your sleep time is included in the fasting time. So you start eating again, you pick up eating again at least 15 hours after. So if you pick 7 o'clock as your cutoff time, then you don't start eating again until 10, 11 o'clock, or even 12 the next day. And when you start eating again, of course, sensible eating, you cut off chips, sodas. Those are huge culprits for weight issues. Chips. Chips are addictive. You take one, you continue to eat and eat till you finish that bag. If you have a second bag, you go for it. So cut those off completely. You don't buy them, you don't put them in your house. Then sodas, whether it is, diet sodas or non-diet sodas, even the diet sodas are worse than, diet sodas most time because of the, supplements and stuff that they put in them, not supplements, wrong choice of word. The high fructose corn syrup, saccharin, and stuff like that, they're not good for you. So you cut those off. You eat sensibly all through the day, and that's another topic, another day to discuss foods that are good to eat and those you should abstain from. You eat small, frequent portions through the day. Dr. Dija said she eats once a day. Um, we know that that could slow down your metabolism also. So if you eat in one meal
One
once
meal,
a day,
one meal. I
one
eat
meal.
like fruits and oranges, apples, throughout the day.
Okay, you
Yeah.
got to remember
But I
though
eat
that,
one meal.
okay, I was going to say that
Let-
if you eat one meal, then
About
you should, if you eat one meal a day, then you should snack, like you just said,
Yes,
but
I
be
do.
mindful of the fact that fruits are high in sugars,
Sure.
in natural sugars.
Yes,
So
the sweet
balance
tooth.
it. People will make smoothies. When you do your smoothies, please add vegetables like spinach,
I do spinach,
kale,
tomato.
bitter leaf. I don't even know about the,
Uh-oh.
the tomatoes. I don't know.
I
It,
do
try
tomatoes.
try the
I do
bitter leaf.
carrots. Ah,
No, try the bitter
fresh
leaf.
bitter leaves, if one can
Try,
find them. I don't
try
like the
the
dry
bitter
bitter
leaf
leaf.
in smoothies, and you will see that it's not good
Wow.
because of the sweetness of the fruit. So again, you continue small frequent meals and cut off eating again at 7.
Dr. O,
The
let me
rest
chip
of your metabolism, just 1 minute, please. But you have to couple this with exercise. Like Dr. Alu wrote in there, walking several kilometers, we recommend like 30 minutes of brisk walking. It's not Jelenke walking where you just, walk like that. Brisk walking, smooth, swing your arms for like 30 minutes. Start every other day, and you'll be surprised. Once you get used to it, you want that exercise at least once a day. And when you do that, it's a lifestyle change. Even people around you at 7 o'clock, if it's 7 p.m. you pick, they'll say, she or he will not eat anything after that time, if they offer you something to eat, because it's become your lifestyle change. That's what we mean when we talk about lifestyle changes. It's you've changed your lifestyle. This is now how you live, is what that means. And we see that when you would take off the weight, like 1 pound a week, maybe 4, 5 pounds a month, you will sustain it. You will keep that weight loss because it's a lifestyle change. But I'll tell you, when you do that, you may come to a place where you plateau.
Yeah.
The weight, you stop losing weight. So you have to add something else at that point. You have to change gears to continue that weight loss till you get to that weight that you need to be. And Dr. Kukwala, I've talked about this. Weight has become a disease entity, especially weight around the waist. It causes, like he said, cardiovascular problems, that's heart issues. It can cause high blood pressure, diabetes, the list goes on. So weight is not our friend, or let me say excess weight is not our friend. So I hope I answered your question, Dr. Alu. Yeah, over to you, Dr.
Let
Popoola.
me, yeah, I want to jump in when you are describing intermittent fasting.
Mm.
Um, what you describe is actually regular fasting in your own pattern. Intermittent
Excuse me?
fasting would be, yeah, the intermittent fasting will be because you want to get to a certain reduction of calorie. That's the bottom line. Because during the first 6 hours of fasting, okay, and your body is still not going to continue to change the kind of fuel that is using. Intermittent fasting actually allows you to bring the body from one extreme to the other, then come back again. I was doing that during my athletic days in particular. We needed to do that when we are doing carbohydrate loading and all that. But this is what you describe is just a more regular fasting. The intermittent one is like maybe every other day, you actually let your body be short of the calories, be short of the food types significantly for your body to change, okay, the kind of metabolism you are doing. So that is a way that will take in time. However, whichever pattern you use, that is what you want to achieve. You want your body to actually get to another pattern, okay, which will become desirable down the road. Now about the effect of
Okay, before you go on, I just want to say I'm a medical doctor, and I want to say that intermittent fasting is an evidence-based therapeutic eating strategy that is often used to improve metabolic health, to manage the weight, and reduce risk of diabetes and heart disease, which I said earlier. It is not diet or intermittent fasting like I prescribed. This is
oh,
what
oh, sorry for the use that you prescribe.
no,
Uh,
it is not my prescription, and I wish I could claim that I came up with it. I can make that claim because I did not. But it's an excellent way to change lifestyle, to improve health, to prevent disease entities. It is not Dr. O or Tony Okwesomi's invention.
Yeah, and I
okay.
think also there's the short number of hours, there's the long 16 hours. If you don't do 12, there's 16. That's the type Dr.
15.
O is describing, right?
Yeah.
Yeah,
And
okay.
your
I
sleep
did that
time,
before.
your sleep time is actually included in it.
But that's just a
That's why
routine.
you cut off at night, because the sleep time is included in that 15 hours. It makes it easier for people to be able to do that and get results. So, and you said earlier, Dr. Dija, that medications are needed for some disease entities. Somebody has diabetes, they have high blood pressure, they have thyroid problem. They need to be on medication long term, till the rest of their lives. Some people have diabetes and high blood pressure, not even because of weight. They could have
Yeah,
inherited it. and there are many other reasons why people can have these disease entities. In those instances, the medications are needed. I don't want people to walk away to think that,
Thinking I
no,
didn't say that or mean that. But
okay.
what I meant, for example, someone that has multiple disease states, comorbidities, right? Then becomes polypharmacy. So if it's somebody that is borderline diabetes, for example, and we're able to use lifestyle to help that person, now we can remove a certain medication. It will be helpful. That's
Excellent.
what I meant.
That's the
Yes.
point.
Yeah.
These medications that Dr. Popoola capitalized on tonight, they are not indicated for pre-diabetics. Insurance companies don't cover them for, and I don't use the word pre-diabetes actually when I actually, was treating patients, because pre to me means you're going to develop that
Develop.
thing. I use increased risk of diabetes. So you have increased risk. We can do lifestyle changes and see how we can prevent you from becoming full-blown diabetic or increase the time to which you develop it by doing lifestyle changes. You are 100% right, you know, um, for that. I'm saying for people who have diabetes, we have to, they have to be on
You
medication
have to be.
with lifestyle changes. Dr. Buka also just put in the chat box that we must consider mental health problems in obese patients. Obese, yes, the people say obese. I don't like to use that word also. I say, you have weight. You have weight on you that we need to deal with because it's not easy. It's not easy. There are many reasons why people, just, put on weight. Mental health is huge. We know that one of the symptoms of depression is increased appetite or decreased appetite. It can go either way because diagnosis of depression is a constellation of symptoms. So if somebody has increased appetite and they keep eating and eating and eating, of course they'll keep putting on weight. There are also other reasons why mental health issues, why people can put on weight. Even some mental health medications will put weight
Side
on people.
effects. Yes.
Exactly. So mental health is very important when dealing with weight. And Dr. Kukwala mentioned gastric bypass surgery, there are several surgeries that can be had to help with weight loss. In the past, these surgeries were just done. Okay, you have weight on you. You need to lose weight, and we do the surgery. It's not done like that anymore. Now it would take at the least 6 months from the time that it's decided that a patient needs this intervention, surgical intervention, to the time they actually get it. And the reason is because they have to follow with nutritionists, psychiatrists, and they have to start exercising, change lifestyle, and in that period, start losing weight. It may not be a lot because their lifestyle changes and exercises will cause weight loss. May not be a lot, but they can see that okay, they are now on the path of success, so that after surgery, the lifestyle changes and exercises can be continued to sustain the weight loss that they would enjoy after the surgical intervention. So, mental health is very important. I agree with Dr. Buka. And I am thankful to medicine because research helps us to change things, to improve, and to better the space. That was one of the improvements we have had in weight management. But
Thank you.
Dr. Dija, I'm so proud of you. I
Thank you, Mom.
mean, from the weight 240,
46.
46 to where you are now, you look fantastic, amazing.
Thank you.
People should see you in person and say that you look great. So
Thank
you've
you.
done a great
Thank you,
job.
ma'am.
And you off medications, you're now on lifestyle
Yes.
changes. That is great.
Yes.
I think I should connect you to Dr. Popoola on the back
Okay.
end because it can help with physical therapy to, to help those joints,
Helping.
yeah, that are causing pain to start off with so that you can exercise some more.
That would be nice. Thank you so much, ma'am.
So Dr.
One
Popoola,
comment. One comment. You know,
go ahead.
Dr. O, I go to the gym maybe 3, 4 times a week. And whether it's lifestyle or just to get my spot, Oimbo people, snow or no snow, they're there. 86-year-old John is there, even if he sits on the chair.
86-year-old.
86, yes. And the lady whose spot I took over, she was 87 when she left. She didn't die. But let me tell you, even when I look and say it's cold and I jump up, the class is full, the yoga class, Monday,
Wow.
Tuesday, Wednesday.
Wow.
So when you see that, you say to yourself, John is 86 and he's there before me. What is wrong with me? And everybody has their spot. Sometimes when I went to Nigeria, I said they can take my spot. I won't be here for a while. It is that it is that caustic that we end up there.
Wow.
Some of them walk in the cold to the gym. So there
Wow.
is, if you want to do something, you do it. Today I couldn't go. I went downstairs and did my 20 minutes exercise. I can't make it tomorrow because I didn't pick up my car. I will do my 20 minutes exercise. It just becomes a part of your life.
Exactly.
And that's what you do.
That
But
was what
Oimbo people don't stop going.
you
Every
know,
day.
that was what I was
Sure,
saying,
Danny's
that if you haven't been
being the company of those people.
if you haven't been exercising before, you should start every other day, with every other day. So you don't overwhelm yourself and you don't kick yourself out of it before you even actually start. And then, you get used to it every day. You don't want to miss it because it's so good. And if you can make it, taking the longest length in your house and brisk walking, 30 minutes, you get your exercise in. It doesn't have to be the gym or, even going outside all the time if you don't want to, if maybe the weather is too cold or something and you don't feel like going outside, you can still exercise in the house. I did that during COVID. It was an eye opener because I felt like I need to exercise. Let me see, what I can do. And, that was what I did. Auntie Tower, kindly unmute, ma. Yes, ma'am, you have the floor.
Yeah, as far as exercise, I don't know because all my life I exercise. I lost some weight, but it's like what you said. Just play to. I don't lose anything, and I go every day. And in my class, I have 93-year-old. I have 96-year-old,
Wow.
and they come all the time, every day.
Wow.
So you look at yourself, it's like, oh, look, look at this woman. And not that they are doing it perfectly, but at least they are there, they are doing something. So, but what can you do? Because this my lower abdomen, and you mentioned it the last time you saw me. You said, Auntie, your waist something. Yeah, my waist something. You think I want to have it like that? You need to see me when I was in my 50s and see my waist. But I didn't do nothing. I don't eat much, but my waist is there, and I did everything, and it's not moving an inch.
So Dr. Popoola is a physical therapist and, helps people with exercises and all of that. Dr. Popoola, forget the GPL, GPL,
GLP.
GLP, GPL, GLP,
GPO.
whatever. Yes, I'm
Yes.
pulling his leg,
For
um,
Auntie Tiwa, ma'am, I can chip in that.
what can
Well,
she do? What can she do specifically? If you could please answer that question. What can she do for the abdomen to
yeah,
help the abdominal abs? She exercises every day. She goes to the gym every day.
exactly. This is I was approaching this topic from the fact that we finally found something, medication, pharmacology that
Can
could
we
do.
leave the medication? What can she do for
No,
our abs?
no, let's be very pragmatic. many people will tell you that fat area is very stubborn to live. And the reason now that we know that sometimes we have to walk back from the answer to the question, that we needed something to particularly make the body prefer, okay, to burn the fat tissue rather than store the fat tissue. Fat is stored as a way of the body to conserve, to keep energy, just in case the body will need it on emergency. So if your body is so tuned to eat and becomes so conservative that I don't want to lose it, just in case there's going to be a famine, and then I will have to rely on it. That is somehow uh, uh, an anthropological way of looking at it. Okay, the fat settles there not just because we do not do some activity. I can give you abnormal exercise to target the area, but it is really, really very slow and can be frustrating until you take your idea off it. But what I would do if I was in your position, and I don't want to use any pharmacology, and I don't want to do any surgery, is I'm going to use an abdominal band when I'm doing my exercises. And there are particular exercise protocol that targets the core. I'm using that word loosely now. I never like using that word. The core muscle groups. Okay, as abdominal breathing is an important exercise. Then the anterior posterior pelvic tilt is an important exercise, and the pelvic lift, okay, the one I call wiggle and wriggle, which I showed you traditionally, is the most important form of exercise to take care of it. It's going to tone it up, but the bottom line is that the fat in that area, the lower abdomen, takes time before it goes up because the body just keeps it. You rather keep it until a point of starvation before it can be triggered. But we have this medication, I'm going back there. We have medication that targets it. That is why I said they work because of their biochemical and the physiology they bring out of the body. They actually eat up the fat. Okay, they actually target those fat and they eat it up. So if you are going to be on it just for about 4 weeks to 6 to 8 weeks trial, I can assure you the fat will disappear in that area. Okay, but just couple with exercises so that your body doesn't recall back to it and it will not overblow up again. That's what we're trying to say. I'm not a pharmacist, and I don't have and I rather promote exercise for every reason. But when I saw the way this medication impacted people who either two had difficulty taking care of this regional distribution of fat, I felt let's see how we are going to complement it. So side effects is one thing, but the overall effect of this medication is that when you potentiate it with exercise that is directed towards maintaining some particular areas that you have vulnerable issues with, then you have a better outcome.
Okay, so there's another question.
Yes.
How effective is bicycle exercise ride?
Please, can I ask the question? Because I think he answered my question, but Dr. O, you knew that I did some lifestyle with you.
Yes.
Yes, I lost weight, but if you see my arm is as um, and is so skinny. I lost all the fat there, but I didn't lose it where I want to lose it. So if they put me on anything, I will lose fat where I don't want to lose. And the one I want to lose is staying there. I don't know whether it's because of age or anything. Does the age affect it?
Doctor, are you responding?
No, you
Okay.
respond.
Okay. Okay.
I
This
have
is what I
responded.
said. I can write out and send you chat and videos, YouTube videos too, links about those exercises that will target the area. But for the purpose of our discussion tonight, I will still say you can have a 4 to 8 weeks trial of this medication, and you see that it will take care of it. It actually targets, okay, the fat cells. It actually improves insulin sensitivity, okay. We are the fat cells that are useful, and it uses it up uh, uh, as energy. It catabolizes it, so that at the end of the day, if the body doesn't really lose anything. However, if you do not do with exercises, then you might find out that other effects will climb over it. That is what I'm trying to say. That with
If I didn't know, if I didn't know better, I would say you are working for the pharmaceutical company. So I'm going to leave that there as
But what
Auntie
medicine
Tara.
is he referring to? Did
They
you say?
Ozempic, Monjaro, all of
Oh,
those. I said
to
it.
target the
That was why I was
stomach?
feeling. Hmm?
I thought he said he had a medicine for the stomach fat. Maybe I
No, that's
misheard.
what he's talking
Oh,
about.
okay. I
That
see.
get
I
on it,
see.
and it's suggesting that those medications target your stomach.
Mm.
They don't.
target the fat cells,
Maybe
No,
that's when exercise will come in, some kind of
target the fat
dance
tissue.
modulations.
Yeah, exercise will continue steadily as what they call it, synergistically. So because you cannot target it, and fat tissue is actually mobile. It moves into areas where the body is redundant with. So those exercises are listed out. The four of them actually targets the lower abdomen and the pelvic area. Okay. Okay, but to have a rapid change, you still have to, if this pharmacology has been working for this, I think I will still want to, I wouldn't mind somebody who's having challenges about that, to use it to bridge over, and then lifestyle changes will continue to take it on, which you are going to start alongside of this use. Yeah.
So, how effective is bicycle exercise ride?
Yeah.
Can we
Okay. Bicycle exercise is recommended primarily when you do not have when you have problem with taking the absorption of the counterweight. That is the floor reaction, the surface reaction when you are running or when you are walking. The most important exercises to let you shed weight and improve your cardiovascular condition is walking and swimming. Okay, because you use far more group of what do you call it, muscular tissue, okay, than just sitting on the bicycle, whereas you use only your lower extremity significantly. So bicycle ergometry will improve your general cardiovascular conditioning, but without particularly targeting weight in your lower, in your abdomen or in your arm. Whereas you need whole body exercise for an optimal. We use it because it is the most convenient way to let people exercise, break into exercise, okay, and be able to continue by themselves. So it is very, very useful. We still don't have an alternative to that. They are using the rowing machine. It's also superior to using bicycle, okay? Because look at it, the muscles of your torso and your pelvic region and up to your thigh, okay, are not really used significantly during bicycle ergometry. Okay, so that is what it means, that you are using far less group of muscles than either thing level. In swimming, you are using almost every group of muscles in your body. All of them participate. Okay, and most of us cannot swim that distance that will let it have effect. So walking remains the standard uh, for less weight loss and conditioning.
Thank you. So I would say it that it's better to walk or swim than to be biking.
No, you bike. Bye,
Okay.
bye, bye, bye. Okay, in studies, okay, you did finish my introduction. My primary area, okay, my secondary area is also exercise physiology, but I was a master's. doctoral.
That
And
was what I thought you would talk about today. I knew that.
so I'm a physical therapist. That's what for several years. That's the only thing I said. That's the only thing I know. Got to make sure that, by the scientific basis of exercise and the physiology and what they call it, the biology of biochemistry, is well in tune with what I practice. And we're
No,
still
but
the patient.
the question I was asking is are you saying that it's better to walk and swim than to bike, or biking is okay as exercise? Just in a
Biking is
nutshell.
okay. Biking is okay, very, very okay as
Okay,
exercise because it is convenient, it is affordable.
okay,
Okay, even though you are not using uh, 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 a large portion, a good portion of your muscular tissue. Okay, the effect on them is far less than when you do walking on your swim.
okay. Fantastic. So Dr. Alu was asking um, if these medications you talk about have side effects, and I've responded yes. They mostly have GI, gastrointestinal side effects like nausea, vomiting, diarrhea. It could be constipation. Dr. Popoola said he had diarrhea first, and then he had constipation. But also thyroid cell tumors
Yep.
can occur. I'm talking about, common side effects. And Dr. Buka alluded to that after she started the medication, then she developed this lumps in her thyroid. So that was evaluated. They weren't cancerous, but she still needs to follow them. It's still being followed. So those are some of the side effects, but they have other side effects. It can affect kidneys, pancreas. Those are
Yeah,
not common
hepatitis is a
side
very
effects.
important one that has been mentioned in almost every literature.
Yeah.
Hepatitis.
And of course, because it's a medication for diabetes, it can cause the blood sugar to slam down too low. What we call hypoglycemia can occur when the blood sugar becomes too low. That can also occur. So, any other questions? Dr. Popoola, kindly give us your concluding remarks, take home message, and we'll let you go so we
Thank
can
you so
get
very
back on
much.
the road.
I'm in the car already anyway. It's
Yeah.
comfortable. I'm by myself and the car is a home as at now. Um, Honestly, it's a privilege to always talk on come on this with Dr. O because you make it a kind of family discussion where people chip in and give their knowledge and experience uh, to boost, and you're always so very kind. So primarily, what we're trying to look at is that this new medication are the rave of the moment. Okay, if you look at Charles Charles Barkley, and so many other people like that, I can bet they use this medication. Okay, and so many other people. So it's like the rock star medication of our time. Anything rock star, have secondary effects, particularly tending toward abuse. Okay, so whereas the benefit, okay, is going to be there. However, the benefit can only be realized if you synergistically use it with exercise therapeutics in a scientific and pragmatic manner. One thing I did not mention, even though I didn't want to mention it, okay, as a Muslim, I'm fasting. That's also one of the reasons why that I stopped using it, because that would have been three things together: exercise, pharmacology, and fasting. And I said, you're going to end up crashing every kind of physiology in your body. But basically, I can see that even if I use it now, I can cope with it. I do not feel loss of decline of my energy. Okay. So I can very much say that it will help in circumstances, but for you to have the optimal reason why you want to lose weight, why medically you want someone to lose weight, okay, to reduce the impact of sedentariness and obesity and diabetes and high blood pressure, okay, and kidney diseases, renal disease, liver disease, hepatic diseases, okay, and GIT problem. This medication will work, but exercise will potentiate it to improve your quality of life and keep the fat off, even if you are off the medication after a while. I will recommend from that point of view that when prescribing this medication, have in mind that you also have to have supervised, monitored, and prescribed exercise therapeutics. And then I can go to measure with it. Another thing I didn't mention is that the cardiovascular medication that often many people who are in this, who are caught in this relationship of metabolic syndrome and obesity and all that, they also are synergistic with this medication. However, we want to know that some medication, like the beta blockers, will blunt the heart rate response, okay? And some medication like Vaseline seems to be more tolerable when you are using it. These are areas that, as a physical therapist, we do factor in when we are looking at this medication. We're looking at the semaglutides, okay? We're looking at the other medication they are using, and you are looking at the exercise and the impact it's having. We're checking the body weight, we're checking this is laboratory, VO2 and other things, but rating of passive exertion, okay, is a tool that I would rather use even rather than taking the blood pressure and the heart rate, because the patient will give you an whole body kind of feeling, and the secondary effects of the medication will be more limited. If you have that as a take home, I appreciate that I've at least communicated something. Thank you very much. My pleasure, and I appreciate the privilege.
Thank you so much for coming, and thank you. I know that you're on the road, that you still, did the presentation, and we appreciate you. We
I don't
appreciate.
usually Muslims break their fast at sunset. I just took a sip of water. I haven't broken my fast. I don't even feel like eating.
That is what I wanted to ask. Have you broken your fast? Because it's way past time.
Yeah.
It's okay. It will be okay.
Mm.
Even